what can we do to save wisdom teeth in young people? That's
Well,
the $1,000,000
well,
question.
I'll put it to you this way, and I get this all the time, because I treat a lot of kids. I've got a little glass, and I've got a big glass, and it sits on my desk, a little one and a big one, and right in between them, I've got 32 jelly beans. Now, do you have jelly bellies?
We do.
Yeah, right. So 32 jelly beans. 12 of them are the delicious jelly bellies. Yeah. And the other 20 are the bigger jelly beans. And they're all red, and no flavor to it. They're all the same. And I take the big glass away, I put it to the side, and I give them the small jar. And I say, I tell you what, you're looking at my 32 jelly beans there. You can have as many of them as you want, but they all have to go in the glass. And they go, great. And they get the 12 jelly bellies first, and they put them in the jar, and then they try to crush in as many of the bigger jelly beans, the red ones, on top. Yeah. And deliberately, there are 8 red jelly beans that can't fit in the glass. But they don't care. They've got the 12 jelly bellies. They've got, at least 10 of the others, 12 of the others. And I go, are you happy with that as an outcome, that you only got 24 jelly beans? Yeah. And they go, well, Paul, you only gave me the small jar. You only gave me the small glass. Why don't you give me the big one and we'll play the game again? So I give them the big glass. And of course, they get the 12 jelly bellies in. They get the other 20 bigger jelly beans in. Now they've got 32 jelly beans in one jar. And they go, I get to take this home. And I go, and that's how IMDO works.
Wow. You're giving them the big
Right?
jar.
You give them a big jar.
Yeah.
Otherwise, you can't fit them in.
Mm.
Yeah. And if I give them the big jar, they don't get sleep apnea either.
Mm-hmm.
Ever.
Hmm.
And they look good.
Yeah.
It's about keeping the furniture in the room. You don't get rid of the furniture. That's your anatomy. Simply because someone says you don't need their chair or table or old TV. Yeah. Once it's gone, it's gone.
Mm.
You don't get it back.
No, you don't.
So if you've got a claim that people are making your jaws bigger, yeah, you know that it's not true unless you get to keep 32 teeth. Yeah.
Sure. But what about...
You know it doesn't work unless you're never going to get sleep apnea or snoring for the rest of your life. You know it hasn't worked if you lose your tonsils. You know it doesn't work because you still look like you've got a small jaw. Yeah. That's how you know.
What about the maxilla, though? I'm sort of dragging us back into the technical domain, but you said IMDO gives you the bigger jar, but IMDO gives you the bigger lower half of the jar. But what about the lid?
Well, that's surgery. That's about making the upper jaw bigger 3-dimensionally. And IMDO surgery too. Remember I said to you, so is wisdom teeth surgery. That's jaw surgery too. Yeah. So when people say you don't want to have your jaws operated on, well, count the number of operations that you're having already. Tonsils, adenoids, wisdom teeth, premolars, years of orthodontics, splints,